Hello, I'm David Steensma from the Dana-Farber Cancer Institute and Harvard Medical School in Boston, and I'm co-chair of the Great Debates and Updates in Hematologic Malignancies meeting in New York City. This meeting is focused at the community practitioner and has a lot of clinically relevant updates and information about hematologic disorders, both hematologic malignancies and some non-neoplastic hematology topics. I was a co-chair for 5 of the sessions at this meeting, including chronic myeloid leukemia, chronic lymphoid leukemia, not so benign hematology, acute leukemias, and the myelodysplastic syndromes and myeloproliferative neoplasms. We heard a broad range of talks, primarily about incorporating novel targeted agents into hematology oncology practice. We also had updates on several topics related to non-neoplastic hematology, including thalassemia, hemophilia, and sickle cell anemia. It's exciting that there are new approaches for these patients as well after many years of primarily consisting of approaches of either factor infusions for hemophilia or supportive care, iron chelation for sickle cell anemia and for thalassemia. There are now some targeted agents focusing on things like p-selectin inhibition or oxygen dissociation in sickle cell anemia. And in the thalassemia, some very exciting advances in gene therapy. Gene therapy is now already established for hemophilia and is really moving forward and helping many patients. So we heard from Dr. Jordan Slavitt from the University of Michigan about hemophilia, from Dr. Sujit Sheth from Weill Cornell Pediatric Hospital about the thalassemias. This morning we heard about acute leukemias. Dr. Amr Zaidan from Yale and Günter Koene from the Miami Cancer Center debated about how we can use the 4 newly approved drugs in 2017 in our clinical practices for patients with AML. This includes enasidenib, gemtuzumab, which was reapproved after it had been taken off the market in 2010 voluntarily by the manufacturer after FDA concerns were raised. CPX-351, a liposomal formulation of daunorubicin and cytarabine, and midostaurin, the FLT3 and other tyrosine kinase inhibitor that was approved for FLT3 positive AML. Dr. Richard Stone, the chief of staff at my institute and a very wise leukemia practitioner, then gave his perspective on how to incorporate some of these new agents. We also heard about some very exciting developments in myeloproliferative neoplasms. Dr. Ruben Mesa talked about patients with so-called triple-negative myeloproliferative neoplasms, those who lack JAK2, calreticulin, or MPL mutations. Dr. John Mascarenhas from Mount Sinai Hospital spoke about a number of new agents that are moving forward in the myeloproliferative neoplasms, a number of studies that he's been involved with, which include novel JAK2 inhibitors, JAK2 inhibitor combinations, a pentraxin analog, a telomerase inhibitor, a BET inhibitor, bromodomain inhibitor, and most exciting to him, idesnutlin, an MDM2 inhibitor, which is showing some very striking results in polycythemia vera. Amy DeZern updated us on the new drugs in myelodysplastic syndromes that are in clinical trials. We haven't had a new drug in MDS for a number of years, and Dr. DeZern really gave a very nice summary about all of the different trials that are moving forward, so that hopefully MDS will be like AML, where we have some FDA approvals to talk about in the years to come. She then debated Dr. Rami Kamrokji from Moffitt Cancer Center about this group of IPSS-R intermediate risk patients, whether they should be approached like lower risk or higher risk patients. Yesterday, we heard about several aspects of management of patients with chronic myeloid leukemias. Although CML has been the poster child for successful targeted therapy in oncology. Many patients don't do well with the available tyrosine kinase inhibitors, and Mike Morrow from Memorial Sloan Kettering discussed some of the approaches he uses to try to help patients adhere to therapy, as well as some of the novel agents and approaches that are moving forward. And there's still a few patients each year for whom stem cell transplant is the right option if they just have done very poorly with all of the different available TKIs. Dr. Marlis Luskin from my institution at Dana-Farber discussed the approach to CML in either the patient who is pregnant or wants to become pregnant or the pregnant partner. Very emotionally fraught and challenging situation, but one that can be navigated successfully in many cases with a happy result in the end. Then Michael Morrow came back and he talked about some of the stopping trials. One of the great successes of tyrosine kinase inhibition is that the drugs are able to actually be stopped in some cases and the patient apparently cured. He talked about which patients are the best candidates for stopping the drug and what some of the trial data have shown us about likelihood of relapse and how frequently those patients should be monitored. In the CLL session, we had the fourth edition of a debate between Rick Furman from New York and Matt Davids from Boston, continuing this New York-Boston rivalry. They were discussing where targeted therapy should be used in CLL and whether the therapy should be given in combination or sequentially, as there's such an embarrassment of riches with respect to CLL therapies. Lots of new drugs, new highly active drugs, and this is a disease that's really, I think, on its way to cure. And then Joe Lace from Mayo Clinic, Arizona, who's the head of the Mayo Clinic CLL disease-oriented group, spoke about some practical considerations of using BTK inhibitors and other targeted agents in CLL. So all in all, I think it was a very practical, hopefully very useful meeting where a lot of key insights were shared into how to use novel agents, which patients are the best candidates, what kind of adverse event management needs to be taken into account, and it was hopefully useful for the target audience.